we know that physical activity significantly impacts heart disease. So the effect on cardiovascular mortality, so live or die, according to New England Journal of Medicine, reported that without physical activity, there is a 72% increase in mortality. So you have a patient in front of you, and this individual has cardiovascular risks, perhaps has high blood pressure, maybe high cholesterol. They are inactive. 72% increase in mortality. Isn't that a conversation we need to have? And 70% of cardiovascular disease can be prevented or delayed with a combination of the two. Let's talk about physical activity and cancer. Again, I want you to keep thinking the people you have in front of you. How many of you work with patients who have a history of cancer, who have a risk factor of cancer, so cancer in their family tree? Perhaps were prior smokers, individuals who have a risk for skin cancer, etc. So exercise supervised by a PT can help anyone who is undergoing cancer treatment exercise safely and effectively. A lot of cancer patients experience significant fatigue, and their response to fatigue is not doing anything. But we know that physical activity can impact people that are dealing with cancer. So we can reduce fatigue because it actually boosts energy, especially if it's dosed appropriately. It can maintain muscle strength, so it can keep them active and moving so they aren't at risk for other things, reduce the stress. Having a cancer diagnosis in and of itself is stressful. It can cause problems like depression, fear, anxiety. And where do individuals with cancer go with that? Well, certainly they can take additional medications, but when you think about someone who's already taking medications and you introduce antidepressants, you're talking polypharmacy, drugs that could interact. So exercise can be a very positive way to deal with that stress.